I just want to tell you, Mo, there is hope for your hair. I had no hair in April, and this is what I got now, so hang in there. Okay, last year I talked about the financial cost of care. This year I'm going to really depress you all and talk about the non-financial cost of care. I have, well, actually now I have 3 daughters, but at the time was married, I had 2 daughters. I was a stay-home mom, and in 1995, one Saturday morning, my daughter woke up to go watch cartoons, and she went down I heard her go down the stairs, and then I heard wham, 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 and she had fallen down the stairs. Well, I'd leap out of bed, run around the corner, and there she is at the bottom having a seizure. And that was the beginning. We were 5 years before. She had myoclonus, muscle jerks. Hiccups are myoclonus of your diaphragm. Can you imagine having myoclonus of everything? Your muscles, your arms, your legs, your stomach. It was pretty bad. And this was a kid that went from being a role model for the friends group at 2nd grade, and she was on swim team, she played basketball, she played soccer, just a good all-around kid, a good academically, was in the gifted program, and she just went downhill. We had 3 steps to get from the back door to get outside, and I can remember her crawling down the steps backwards in the rain because she could not walk down the steps. And the insurance company said, "Oh, just live with it." Well, you can imagine what I said, and it's not printable. Anyway, we were 5 years with no diagnosis, terribly stressful time. We spent everything we had on Chelsea, of course. I mean, that's what you do. You save for a rainy day, and believe me, it was a monsoon. We saw every pediatric neurologist on the East Coast. We went to Houston. We saw 3 people out there. And finally, the second time at Johns Hopkins, we got a diagnosis. The gene had just been discovered in 1999, and she had Unrich-Lundborg disease, which no one's ever heard of, including the neurologist. Well, anyway, I found a guy that specialized in it. He had just moved to Illinois, and he had 20 patients all over the United States. And it's hard not to talk about the financial part, but just for interest's sake, because we've been living with this for 23 years. How's it affected me? Lost work time, life choices, loss of friends. You don't have time for friends, and people don't want to hear you say, "Oh, my daughter's worse." The stress is incredible. You are waiting for the other shoe to drop all the time. And to give you a couple examples, when we were coming back from Texas one time, it was just Chelsea and me. She had a seizure coming off the plane. Just don't have a medical emergency on an airplane. They get really panicky. We went on a cruise ship to give ourselves a break. The whole family went. She got in the pool. She was a beautiful swimmer. She swam beautifully. She nearly drowned because the ship rocks, so the water rocks, and she could not stand up. I was sitting there watching her. I watched her head. She did swim team, and I watched her head for however many years. I found out later, her sister, who's a year older, told me, "Mom, I was terrified at every swim team practice because I was afraid Chelsea would drown." And I said, "You were 10 years old. I never asked you to watch her." I said, "That was my job," and I always watched her head. And Megan goes, "I don't care. I just worried about her." I had a friend that she told me after about 5 years, she said, "I have never been out with you anywhere that you didn't get a phone call saying, 'Come home, Chelsea's in trouble.'" I had to find care for my kids at home, and we had another baby after this, and she was the gosh, she was the joy we needed so badly because everything was just, it was just awful. And to bring a new baby in, and she was healthy, and she laughed, it was a great distraction for us. And we were lucky. We got everybody tested eventually, and that baby did not have the allele at all. Unbrick-Lundborg disease is autosomal recessive. Tom and I were both carriers. No, we're not related, like they asked me at NIH. The older daughter is the carrier only, and the youngest one doesn't have it at all. Chelsea takes roughly 64 pills a day. I had to fill pill boxes. I would do 2 weeks at a time, and then I'd make somebody come back and check after me, because if you missed a drug, Lord help her. Long-term, Chelsea has terrible mental health issues. We have a thing on the TV news, and you can look it up if you want to. She was held in the waiting area for mental health treatment for over 24 hours. They would not give her her medication. If she had been diabetic, she'd be dead. She had seizures. What a surprise. Hold anybody's meds for 24 hours, they're going to have a seizure. To save our family, because she was so erratic, and I still had a little kid at home, we found a place for her to live. She's been kicked out of so many of them, but one of them, she was raped in the facility. Unbelievable, just unbelievable. So then I asked the family members, I said, how has Chelsea's disease affected you? And my husband immediately said, depression. The older daughter, she said that she worried that someday she might have a child that would have this, and she said, I'd never put somebody through what I've watched Chelsea go through. She had to have, Megan got married 4 years ago. She told her husband before they got married, she said, someday Chelsea may end up living with us. I just want you to understand that before you marry me. She had him go through genetic testing because, of course, the insurance company's not going to pay for it. And we knew she had one copy of the allele. So they tried to get both of them tested, and Megan said, look, this is ridiculous. You know, it's a $1,000 test. Just get Kevin tested. So he was tested, and he was negative, so we were good. And I just became a grandma 3 weeks ago. One thing Megan said to me the other day, I was so surprised, because Chelsea has drained us financially, and that's okay. I mean, it's life. I'll just work till I drop dead. It's no big deal. But she said, how am I going to take care of my parents? Because she knows we have no retirement. She said, anxiety, what's happening to Chelsea. She said, when I was working, I couldn't even focus sometimes because she would be going through an episode of whatever. And Megan was going, what's happening at home? Faith, my younger daughter, and I was so shocked at this, she worries that she will end up being the caregiver for Chelsea one day. I can't imagine her even thinking that, but that's what bothers her. And this breaks my heart. Faith doesn't want to be around Chelsea. If Chelsea comes home for the weekend to visit and Faith is home, she'll just get up and go in the other room. And it's so sad. Good things have come up. And I stole this phrase from Cynthia. It opened my heart in ways that are unexplainable. My God, I was such an ignorant person before all this happened. Megan is the director of development at a charitable health clinic. She would have never gotten into this if she hadn't lived with the craziness we've gone through for 23 years. And Faith is a college student, but this summer she worked in assisted living, and she was a food server. And the old people loved her. She said, I just listen to them. I'm kind to them. I listen to them. And when she left to go back to college, they all said, now, if college doesn't work out, you come back here and get a job with us. And they are not, the servers were not to take tips and were not to accept any gifts. She had an apron on, and she said more people stuck money in her pocket. So some good has come out of it, but it's hard. It's really hard, and the cost, you know, non-financially is incredible, and you certainly don't need the financial cost of it on top of it all. Thanks.